Hi everyone, it's Dr. Lindner. In this short video, we are going to be looking at birth, and we'll talk about the importance of natural childbirth and then some of the complications that can take place with more invasive procedures, whether it be a C-section, forceps delivery, vacuum extraction. But let's discuss the importance of vaginal delivery first, right? So vaginal delivery is really important because when the baby crowns and comes through the vaginal canal, the diameter of the head in the vaginal canal, the math doesn't quite add up. So remember the way the sutures and the fontanelles and the bones of the cranium work, where they're not solid, they haven't fused. So there's the ability as the baby is crowning for the fontanelles to kind of overlap, and that allows the baby skull to make it through the vaginal canal. And when the skull comes out, it can expand. And when this happens, you get this pumping mechanism. So it starts to pump the cerebral spinal fluid from the brain down the spinal cord and back up to the brain again. When the chest comes through the vaginal canal, it kind of compresses the chest. And as the baby comes out, it expands and allows for that full breath, the full inhalation and exhalation for good tidal lung volume. And when the baby comes through the vaginal canal, the baby takes in mom's bacteria. So now that sterile environment of the intestines is no longer sterile, and the microbiome can start to develop. And that's where about 80% of the baby's immune system is in the gut, which is also why breastfeeding is important for the colostrum, for the bacteria, for the natural antibody production. So natural childbirth is always suggested and strongly recommended. But interestingly enough, they say about 7 out of 10 women opt for C-section for convenience. And, from the thinking process of convenience, I get it. It's quick, it's timed, surgical procedure, but it's no joke. I mean, it takes women almost a month to recover, maybe for some a little bit more, because they are cutting through abdominal muscles, they're moving all the digestive organs to get to the uterus to cut the baby out. So it's no walk in the park. It's serious stuff. So let's take a look at what can happen if there's too much force or forceful traction to the delicate cervical spine. So this picture shows natural childbirth here. Okay, so let's take a look and review some of the neurological structures. Right, here's the frontal lobe of the brain, and here's the parietal lobe. Back here is the occipital lobe. Here's the cerebellum. Then we have the midbrain. We have the pons, and then we have the medulla. Now remember, the medulla is where cranial nerves 8 through 12, those nuclei originate. And a biggie, an important one, is cranial nerve 10 that falls within 8 through 12, and that's the vagal nerve. Vagal nerve, it's called vagal, vagrant. A vagrant individual wanders, and this cranial nerve wanders to about 90% of the human body: heart, lung, stomach, kidney, spleen, liver. And then remember, C1 and C2 vertebrae protect that part of the brain. Okay, so some basic anatomy there. Now remember, the medulla is also where the cardiac center lies and the lung center. So heart and lungs are regulated by the medulla oblongata, which is why they'll often check a baby's APGAR score to make sure that baby is breathing right, heart rate is good, right? Baby's crying, breathing normally. Otherwise, it could be indicative of some autonomic nervous system dysfunction, imbalance between sympathetics and parasympathetics. Cranial nerve 10, vagal nerve, again, largely parasympathetics. Keep in mind, here is the C1 vertebra, here is C2, and then through that you have the medulla oblongata, which is where the vagal nerve or cranial nerve 10, the nuclei, arises. So if there's any type of misalignment between the atlas between the atlas and the axis, you can understand that there's going to be some neurological compromise or nerve interference between what's happening here and its function. So if a baby's coming out and the doctors take the baby's head and they rotate it so that the shoulders rotate and they pull the baby out, that can create that rotation, that forceful rotation can create neurological compromise in the medulla. Now, remember that vagal nerve controls the heart and the lungs. Could this be a cause of SIDS, sudden infant death syndrome? Sudden infant death syndrome or crib death is when babies die in that crib, typically when they're sleeping on their stomach and their head is rotated, creating more of a rotational subluxation or interference to the medulla. Dr. Gottfried Gutmann autopsied 1,500 babies that died of crib death or sudden infant death syndrome and said 100% of these babies had what he referred to as atlantoaxial instability. Atlantoaxial instability means instability between the C1 and C2 vertebra, creating neurological compromise at the level of the medulla. So strong possibility that it's linked to damage to that 10th cranial nerve. So the heart center and lung center shut down. Okay. Here is, again, natural childbirth. There's a little bit of excessive traction that's taking place, which can damage the brachial plexus. Remember, the brachial plexus goes from C5 to T1, and the brachial plexus goes down the shoulder, down the arms, into the fingers, and controls the entire upper extremity. So if there's any type of lesion to the brachial plexus, there's going to be dysfunction to the limb. Maybe it's the shoulder, maybe it's the forearm, maybe it's the wrist and fingers. Here is showing an avulsed C5 nerve root, and this is what an avulsion looks like when it separates from the spinal cord. Then we have a ruptured C6 nerve root, and you can see where it's kind of separated here. And then at C7, it's stretched. We can see down here on the bottom right, the stretched nerve root. Now, depending on where the damage is, if it's up higher or down lower, again, it's going to affect a different muscular distribution. So if it's up towards the top, you see we have an Erb's palsy at C5, C6 that internally rotates the entire arm, and the hand goes into flexion and fingers go into flexion, and it looks like a waiter asking for a tip as they're walking away from the table. So they call it waiter's tip or Erb's palsy. When it's discovered in young children, it's typically a result of birth trauma. When it's a little bit lower in the brachial plexus, at the lower end, they call it Klumpke's palsy. Klumpke's palsy, you see a different distribution of the shoulder, and you can see the fingers are kind of curled up, but they extend back. They don't go into flexion, kind of extends upward into extension. Again, trauma to the brachial plexus. Now, when there's excessive traction, sometimes the brachial plexus can get damaged or parts of the cervical plexus. So here, the cervical plexus goes from C1 to C5, and the brachial plexus shares C5 and goes C5 to T1 for the brachial plexus. But the cervical plexus is C1 to C5. When you have C3, 4, and 5 that are damaged, that can affect the phrenic nerve. Remember, C3, 4, 5 keep the diaphragm alive. That goes to the diaphragm. So another possible cause of SIDS. So the diaphragm can't contract, which is going to affect breathing. So birth trauma should not be neglected. It should not be, it should really be looked at with a close eye. And it is, they say about 1 in 200 births have a form of birth trauma. Sometimes it involves cranial nerves, it affects the ears. Sometimes cranial nerves, it affects the eyes. Sometimes it affects the brachial plexus. So there's a lot happening here. On the left-hand side, we have a vacuum extraction. On the right-hand side, we have a forceps delivery. Forceps looks like salad tongs, like metal salad tongs, and it grabs around the baby's head and helps to lift. That often creates like an egghead type of distortion. Vacuum extraction also creates these suction phenomenons. We also see raccoon eyes in babies that have had uh, skull fractures as a result of forceps or vacuum extraction. They'll show raccoon eyes, which is darkness underneath the eyes, which is a strong indication of a cranial or skull fracture from any of these two procedures. Here is from a vacuum extraction, that suction phenomenon that takes place. Now with birth, it's anywhere from 60 to 90 pounds of force that's being used. There's suction, and then there's the doctor's strength of the forearm and hands pulling the baby out. Here is a facial palsy. You could see half the side of the face. You could see it's kind of drooping on one side. Look at the difference between the eye open here and the eye here. There's a big difference, this facial asymmetry. Facial nerve is cranial nerve 7. That's the cranial nerve 7 is the facial nerve, controls facial expression. It helps to close the eye. So when people blink, you'll see one eye doesn't blink and the other one does. When they smile, you'll see this asymmetry where, it pulls more on one side because one side works and the other is not. A drooping on one side, all can result, when you see it in babies and young children, facial palsy, also known as Bell's palsy. Bell's palsy. We've seen that also in Sylvester Stallone, right? Sylvester Stallone had the facial palsy. He talks about it quite frequently, where he gets that, Adrian, right? It's his claim to fame. So you should be familiar, understand the differences between different types of dysfunction from birth trauma, like if there is a C1, C2 subluxation or neurological compromise, how it can result in cranial nerve 10 or vagal nerve damage, possibly causing sudden infant death syndrome or crib death. Remember that phrenic nerve, C3, 4, 5, keep the diaphragm alive due to too much traction. We understand the importance of vaginal delivery, from the pumping of the CSF to proper lung development and building up the immune system from the microbiome. And so hopefully this kind of opens your eyes a little bit towards the importance of vaginal delivery. And, many moms have chosen to do water birth as a possibility. Water births are quite easy on the mother and quite easy on the baby, where the baby's going from a watery environment into another, and the baby doesn't take their first breath until they come out, right? And the umbilical cord is cut. Many hospitals do offer water birth, and if there's a crisis that needs medical intervention, right, it's kind of like having the baby in water or land. Some people bring doulas and midwives to their home, and they have a home birth. All great ideas, as long as there is also crisis care intervention available, because things do happen. Umbilical cord can wrap around a baby's neck, right? I mean, heart rates can dip and change. So we always want to make sure that all the diagnostics are available, and people can be properly reactive to those type of situations, right? Just do it responsibly, that's all. But I've known many healthcare providers where they've had home births or water births safely. I've known many people that have had vaginal births safely. Many women have had C-sections for the first delivery, and then have had a VBAC after that, vaginal birth after C-section safely. And I've known many people that have had C-sections safely also. So just good if you're getting into healthcare to be aware. I think there was one on torticollis. So torticollis was another one I wanted to discuss, where, let's say, due to trauma, right? Muscular trauma, muscles react. Like if someone's going to punch you in the stomach and the abdomen, your muscles tighten up. So if there's neck trauma from excessive pulling, if my right SCM is in spasm, my right SCM laterally bends and rotates the head away, and you get these babies with this type of deformity. And the sooner it is addressed, the better. It gets much more difficult and complicated as time goes by. But in my 26 years, I've seen quite a few babies that we've had to help out after birth trauma and suffering with torticollis, because then it leads to, if the baby's head is like this and they can't rotate the other way, the baby, as their skull is forming, they start to get this flattening of the occiput in the back, and then they have to wear this prosthetic helmet so that the helmet touches the crib, not the baby's head, flattening it out even more. So many different things that can happen. But it's a very important rationale where if there is traumatic birth, that babies do get checked, especially by a doctor of chiropractic, for the upper cervical spine at C1 and C2. One of the number one drugs that babies are put on today, infants, are put on antacids because of projectile vomiting, where the baby is drinking either formula or breast milk and it doesn't go down, so the baby throws it up. Why won't it go down? Because that vagal nerve, if it's damaged between C1 and C2 from excessive rotation, the vagal nerve goes down to that cardiac sphincter or the lower esophageal sphincter between the bottom of the esophagus and the top of the stomach. If the sphincter is shut, nothing goes into the stomach and it goes up. If the vagal tone is good, then the sphincter can open and milk or formula can go into the stomach. So I've seen many babies over the years with projectile vomiting. They had major subluxation at the atlas. We had to make the appropriate correction to it, and then the baby was fine. Okay, so hopefully you found this interesting.